edit that out.
A little while ago, I did see the PowerPoint when you could not hear me.
Yeah, okay.
So
Okay, I think I might have to log out again. Hold on.
should
What
I
is
log
going
out or should I stay here?
on?
I
Yeah,
should
you
probably
can
stay here.
say,
I'll stay here because I
yeah.
don't want to mess with the audio.
Okay, all right. I'll be back.
All right.
Mr. Anthony, are you able to see it now? Let's see here.
No.
No, okay. Okay. Audio start up. Hold on, let's see here. Mm, yeah.
It did just change.
Okay, all right. Okay, I think I'm,
There you
all
go.
right.
Okay. So
All right.
now I can see it. If you want to try to give me,
Access to the
yeah.
keyboard. Yes.
Um, Are you able to advance the slides? I mean, just as a check. Okay, there you go. Good. Okay. Should I try to advance? Let's see. It's not letting you give me control. Keisha, can you still hear me? Hello? Can you hear me now? Let's see. Can hello? Can you hear me now?
Yes. Yes, I can hear
Okay.
you.
Okay, so I'm not able to advance the slides. If I cue you, would you be able to advance them?
Yes, I can.
Okay, we've done that before. It looks like that's our only option right now, but
Yes, that's fine.
okay. All right, I'm ready whenever you are.
Do you want to turn your camera on or do you want to leave it off?
Oh, I'd rather leave it off. I'm not really prepared. I didn't know we were going to do that. I'm not really
Yeah,
dressed. I'm not really prepared for that.
yes, no problem. No problem.
All right.
Okay. So we'll be starting in a couple seconds.
Okay.
Okay, I'm gonna wait one more minute to let more people log in.
Okay. Is everyone else muted right now?
Is what?
Is everyone else muted right now?
Yes. All attendees are muted, but I will give them access to their mics. So they will be able to ask questions if they
No,
want.
no, I know, but I'm just asking if you want me to be on camera, I just got to go change my
No,
shirt.
you don't. No, you don't have to. If
Okay. We can do it next time. I just didn't think about it. But it's not a bad idea. We've only done it once or twice before, but sorry I didn't think about it today.
yeah.
Okay.
So I went ahead and I did unmute all attendees' mics. So they do have full audio, but of course, we're gonna wait until the end for them to ask questions.
Right.
Okay, so good morning. My name is Keisha Herzog, and I'm from the Empowerment Program of Families Helping Families of Greater Baton Rouge. Dr. Marilyn Thornton is the Executive Director of Families Helping Families of Greater Baton Rouge. On behalf of Families Helping Families of Greater Baton Rouge, I would like to thank you for joining us this morning. Families Helping Family is a family-driven nonprofit resource center for individuals with disabilities and their families. Our mission is to provide the individualized services, information, and support needed to positively enhance the independence, productivity, and integrations of persons with disabilities into the community. Our program include the Bureau of Family Health, Early Steps, the Empowerment Program, Inclusive Education, the Resource Center for Autism Spectrum Disorder, and through the Louisiana Developmental Disability Council, LECAN, an advocacy network. Across all of our service areas, we provide information and referrals, education and training, and family-to-family and/or peer-to-peer support. Our empowerment program provides families in Louisiana with mental health, behavioral health education, skills, and resources to increase and strengthen their ability to function successfully. We provide in-person workshops, webinars, and parent caregiver professional monthly support group conference calls. We also have travel stipends to offer financial support to families to attend workshops and conferences. The stipend covered transportation, hotels, and meals. Please continue to check your email, our Facebook, Instagram, and Twitter pages for upcoming events, workshops, and conference participation opportunities. Just a friendly reminder, our upcoming program that we have, well, our upcoming event that we have at Families Helping Families is the Friend and Family Inclusive Luau of 2024, which is August 9th at 6 p.m. to 9 p.m. at Liberty Lagoon at 111 Lovedale Avenue, Baton Rouge, Louisiana, 70806. Please visit our website and our Facebook page to obtain the conference call information and all webinar and in-person training registration links. During today's training, we will discuss mental health community resources presented by Anthony Germain of Corman Line Learning. Anthony Germain is the founder of Corman Line Learning, which delivers trainings and media creations on mental health, substance abuse, and professional development topics. He has been a nonprofit executive for over 20 years at the state, national, and international level. Also, Anthony is a New Orleans native, and he was Director and Development and Outreach for Raphael Village, a social enterprise community which provides education and vocational trainings for differently abled teens and adults. Please be advised that this presentation will be muted to all participants who are joining us by webinar. However, you can type your questions in the chat box. At the end of the presentation, of course, I will give all attendees control of the mic if you have any additional questions. Again, we appreciate you for joining. Now I turn it over to today's presenter, Anthony.
Okay, thank you, Keisha. Good morning, everyone. I'm happy to have you all on this presentation. We're going to go over a lot of resources regarding mental health statewide. It's a lot of content on these slides, so just to let you know, if you get in touch with Keisha or Families Helping Families afterwards, you can get a copy of it, so you don't have to worry about writing down addresses and names and things like that. So Keisha, if we could go to the first slide, please. So as many of you might know, July, I know we're at the end of July now. It's been National Minority Mental Health Awareness Month. I know there's been a lot of activities to celebrate this month and bring awareness to minority mental health in July. And just coming up in the near future, September is Suicide Prevention Month. There's a week in October that is Mental Health Awareness Week, but we always want to keep in mind for resources and awareness for mental health, it's a year-round kind of thing, and we always want to do what we can to help our loved ones that have challenges with mental health. So, next slide, please. I always like to start off with some of the latest data regarding mental health, particularly in Louisiana. Over 715,000 residents in Louisiana live with some type of mental health condition. 83,000 of those have a serious mental health condition. In as late as 2022, more than 47% of adults reported symptoms of depression and anxiety. A lot of that is due to COVID, but it's still a very high number even without COVID. Suicide remains the second leading cause of death in youth ages 14 to 24, and also ages 10 to 14. So that's a very high number in terms of youth. And there are different webinars that we give pertaining to helping recognize symptoms of suicide in our young people. So next slide, please. So what I'm going to do here, if you see the map of Louisiana, it's broken up into 10 regions of the state, and they're color coded here on the map. And these are what we call LGEs, which stands for local governing entities. And these are very large facilities in each region. There's one in each area, and that offers lots of mental health services for people in multiple parishes of the region. They're terrific facilities, but they do not do a good job of promoting or advertising themselves. So a lot of people are not familiar with some of these governing entities. So we'll go through them, and I'll tell you a little bit about each one. If you could go to the next slide, please. As far as these community resource governing entities, they provide services like mental health and substance abuse clinics and treatment centers. We'll touch a little bit today on the opioid pandemic, which is a big problem in Louisiana, and we have another webinar that deals with that. But today's focus is on where to go or who to call for resources and referrals, the second line for mental health and substance abuse. There's group homes, professional counseling for mental health and addiction, and then again, referrals also to nonprofits for trainings and advocacy, which is separate from what these governing entities provide. Next slide, please. So we'll start with Region 1 in New Orleans. If you look on the map, it's the bottom right, the sort of beige area, which covers, that's Metropolitan Human Resources or Services District. It's on General de Gaulle in Eastern New Orleans. Now in this area, it covers Orleans, St. Bernard, Plaquemines Parish. It's a very large facility, and they provide psychiatric treatment, telepsychiatry, some people call it telehealth, where you can, if you're not able to get to a facility, you can get counseling through online, on the computer, on your phone. They do medical management plans for psychiatric health, as well as treat people with ADHD. It's a very good, very large organization. And again, with these numbers and addresses, you're going to see a lot of them. But if you want them as a reference, just ask Keisha at the end, and we can send you the PowerPoint, or we can make it into a PDF and send it. Next slide, please. Region 2, you may be familiar with, is Capital Area Human Services. That's Baton Rouge and the surrounding parishes here in Baton Rouge, Ascension, the Felicianas, and that's the red region on the map there. Capital Area Human Services, I've been there. It's an excellent facility. It's on Wooddale Boulevard. There's the phone number there. And each of these governing entities have very good websites. Even if you don't see it listed, you can just Google the name of the Human Services District, and see specifically what the services they are that they provide. So Capital Area Human Services here in Baton Rouge is a go-to place. They accept people. You don't have to have an appointment if you or a loved one are having a mental health crisis. You can just go in, and we'll go more into what they do in a minute. But if you can go to the next slide, please. Region 3 would be the large yellow area at the bottom. That is where South Central Louisiana Human Services Authority, some of these are called authority or district. It's a little confusing, but they all provide the same services. This is a very large facility. I've been there, really wonderful. It's based in Houma. You see the phone number there, and that accommodates people that live down like Thibodeau, Houma, Lafourche Parish in that area. So some of the more rural areas like that area, and then central Louisiana, sometimes these governing entities are really the only place to go if you need mental health services. So it's good to have access, or the phone number, or the website address for these facilities. Next slide, please. So as we go over west, the green area on the map, Region 4 is Acadiana Area Human Services District, located in Lafayette. And again, they serve that community, St. Landry, Evangeline Parish, Lafayette, right in the middle there. Next slide, please. We're going to go into, after we get through the 10, we'll go into some of the more specific services of a few of them. As we go further west, the purple area on the left side of the map, Region 5, that's Imperial Calcasieu Human Service Authority. It's based in Lake Charles, and that's a growing area in terms of population, and it serves Beauregard, Cameron Parish, and again, along Regions 3, 4, and 5, as well as New Orleans and Jefferson along the coastline. Another thing to keep in mind is, with them being near the coast, they're susceptible, obviously, to hurricanes. And whenever, as of the last 10 years, we've had a lot of bad hurricanes in South Louisiana, east, central, and west coast sides. And we have to think of our young people and our elderly, especially, who are vulnerable to mental health stress and PTSD after natural disasters, in terms of if they've lost their home or their job or something like that. And a lot of these governing entities that are along the coast there, they're very knowledgeable about that, and they have like the disaster preparedness programs for people in need of those services. Next slide, please. Region 6, you can see right in the middle, the beige area, that's called Central Louisiana Human Services District. It's based in Alexandria. I've also been to that one, and for being, it's a large facility, but maybe not as highly staffed as some of the other ones in the more populated regions. However, they are a terrific staff. They do outstanding work. And as you can see in the middle there, the beige in Region 6, they cover and support a lot of parishes, many of them rural communities. So, but they do outstanding work. If you live there or have relatives or friends who need mental health support, you could refer them to Central Louisiana Human Services District. Next slide, please. So as we go further north, Region 7 is the top left, the orange region there. That's Northwest Louisiana Human Services District. It's based in Shreveport, one of the larger cities in Louisiana, and it covers Bossier City as well. And then you got a lot of parishes there, Caddo Parish and other ones, and they do a good job over there. Next slide, please. And then, well, not finally, but Region 8, right next to it, there is Northeast Delta Human Services Authority. That's based in Monroe. and covers towns like Monroe and Ruston and a lot of parishes, Washita, Jackson. Northeast Delta Human Services Authority, even though it's a lot of parishes, the population in that region 8 is not huge like it is in maybe East Baton Rouge 2, region 2 or region 3 in New Orleans and 2. But they do outstanding work, and a lot of these governing entities also provide events in the community where you can get information about their services, meet some of their staff. So if you ever are in any of these regions or you follow them on social media, you can find out when their events are, and they're very helpful. Next slide, please. So Region 9, as we go back south to the right there, is the blue, the dark blue, Florida Parishes Human Services Authority. It's based in Hammond, and that facility helps support people in St. Tammany, Tangipahoa, Livingston parishes, and it's rural, but it's a lot of people have been moving to St. Tammany and the Florida parishes over the last 15 years, particularly because of Katrina. Maybe they want to get a little further north. So the population is booming in that region. So that means they're going to have more and more of a need for mental health services, in Florida parishes. Human Services Authority does a great job there. So next slide, please. And finally, Region 10, it's hard to see, but down at the bottom, the light blue area, that's Jefferson Parish Human Services Authority. Now that's in Metairie. And if you're not too familiar with Orleans or Jefferson, Jefferson Parish includes like Metairie, which is a highly populated area, Kenner, and also the West Bank of New Orleans on the other side of the river, separate from Orleans Parish itself. But Jefferson Parish Human Services Authority also has a lot of good programs in the mental health area. So next slide, please. So as we get into more detail, I know this is a lot of content here, but at the point for like capital area human services, as we mentioned, the primary governing entity here in Baton Rouge on Wooddale, their basic hours, 8 to 4:30, Monday through Friday. They do accept Medicare and Medicaid, which is very helpful. They offer services such as adult mental health, recovery. You can go get services there on an outpatient basis. They have an adult mobile outreach and crisis prevention teams or units where if someone's having a mental health crisis in the community, they can send a team of professionals out to assist. We're really working hard in East Baton Rouge Parish and other parishes to try to prevent what used to be, if someone was having a mental health crisis, someone would call 911, the police would take them, they might go in jail for a day or two, then they let them out, and they're back with no help. So we're trying to fill that void and provide services for these individuals. And so Capital Area also has preventative, primary, and behavioral healthcare coordination, meaning for younger people and children. They even do screenings and interventions and wellness services. So I highly recommend that. A quick way to find out what's going on with these governing entities around the state is they all have Facebook. I'm not sure about Instagram or Twitter, but they all have Facebook pages. So if you just search them on Facebook and follow them, you can see when their events are coming up. And all of their events are free to the community. They do post-incarceration service coordination, as I referred to a minute ago, with people who maybe were incarcerated and they come out and they need to get some mental health counseling. And I mentioned earlier about emergency and disaster preparedness. Capital Area Human Services provides treatment teams, which may include psychiatrist, psychologist, social worker, substance abuse counselor, and a nurse for medical treatment if necessary, or any combination of those professionals. So it's a terrific organization right here in Baton Rouge. And if you go to the next slide, I think they do have, they do have a children's behavioral health unit in Capital area where they'll provide outpatient treatment for children, and then they can focus on assisting people with addictive disorders. And now school's about to start soon, and so a lot of families there'll be some stress around getting ready for school. School-based therapy programs. They have a child and adolescent mobile response team where if they're, again, like I mentioned earlier about the adult mobile response teams, if a young person or a teenager is having some sort of mental health episode, they can send professionals out to that location. And then they also have a family care center. So next slide, please. Also, with Capital Area Human Services, they have what are called satellite clinics. And these are designed for other areas for people to have access to if they're not like near in the city of Baton Rouge. The Margaret Dumas Mental Health Center is on Harding Boulevard. East Feliciana Addiction Recovery Services is based in Clinton. And then West Feliciana Addiction Services based in St. Francisville. So these are all good satellite clinics that people that live in those areas that are less populated, less resources, they can contact one of these satellite clinics if you need help. Next slide, please. Also, I'm sure many of you may be familiar with the Bridge Center for Hope, based here in Baton Rouge on Florida Boulevard. Just opened a few years ago. Fortunately, there were the taxes passed in voting in East Baton Rouge Parish to fund this center. And the good thing about the Bridge Center for Hope is it is open 24 hours a day, 7 days a week. And it's designed to support people having a mental health crisis or an addiction issue. It's a short-term mental health or substance abuse crisis stabilization center. Treatments available for individuals 18 and over. Anyone experiencing a mental health or addiction crisis is welcome. They provide services like crisis observation unit, short-term psychiatric unit, a detox unit, which is very important, a care management team, and they also have a mobile response unit. Some data just came out recently that they've been serving literally tens of thousands of people have gone in and out or through the center each year. And that's good, but it's also a sign that how desperately we need all these organizations to help people with mental health or addiction issues. But the Bridge Center, just remember, it's open 24 hours, 7 days a week. Now, when it says short-term mental health, that's not long stay. They are designed to keep people, the police or whatever response team brings someone in. We want to avoid someone who is not committing a crime or hurting anyone, avoid taking them to jail, right? And so the Bridge Center is one solution for that, where they can be evaluated by professionals in mental health and determine if they can be put in a longer care center or if they can be treated as an outpatient. Next slide, please. Our Lady of the Lake, a lot of people don't realize, Our Lady of the Lake is a large facility in South Baton Rouge, primarily, of course, for medical, physical and health issues, but they do have what's called the St. Clair's Health Center. It's a psychiatric facility for inpatient psychiatric treatment, okay, where people with more serious conditions or traumatic or PTSD, or maybe they have bipolar condition or something even more serious, they can stay there depending on, the insurance and things excuse me, things like that. It's also an adult chemical dependency and alcohol treatment facility and serves acute behavioral crisis assistance, suicidal ideation. What that means is if you know someone who is threatening self-harm or harm to anyone else, they have professionals on staff that can assist with that. They also have a child and adolescent partial hospitalization program, children's crisis intervention program, and then they do counseling for adults, children, and families, postpartum wellness program for women who have had children, and along with that sometimes comes stress and mental health issues, as well as the physical issues with pregnancies. And they also have a substance abuse walk-in service where people can get mental health first aid and then go through wellness and recovery center there. So there's a lot of options there. I should have it on here, but you could call them to find out if they accept Medicare or Medicaid. I want to say they definitely accept private insurance, if not, but I'll check into that for next time. So next slide, please. Also with the Baton Rouge St. Clair, the inpatient psychiatric unit, again, just like Bridge Center for Hope, it's a 24/7 facility, and they do children's crisis intervention services, counseling for adults, substance abuse walk-in, mental health first aid, and as we said in the last slide, wellness and recovery. So next slide, please. Also in Baton Rouge is the IRIS Domestic Violence Resource Center. They have a 24-hour crisis line, which the number is listed here, and it's very purely confidential. And they provide counseling and case management for people victims of domestic violence. They have a housing referral source service, legal advocacy, community outreach, and it's a resource center. They don't have the address listed there. They don't really publicize it for the safety of their residents who may be staying there temporarily until they can get into safe housing. Now, people who fall victim to domestic violence, which is too common here in Baton Rouge, it also serves Ascension, East Baton Rouge Parish, East Feliciana, Iberville, West Feliciana, West Baton Rouge parishes as well. So not just people in the city of New Orleans, but it's a very valuable resource center. And if someone needs to call, again, it's very confidential. The number's listed right there. So it's domestic violence is a big problem that does not get publicized in the news a lot or things like that. Sometimes people who suffer from this problem have to find resources on their own. So this is one of them. Next slide, please. Also, Youth Oasis in Baton Rouge is located over on South Acadia near Government Street. Youth Oasis supports youth and young adults in the 16 to 21 age range who are recovering from the trauma of maybe homelessness or separation from family. They may have their housing problems, healthcare problems, and Youth Oasis does advocacy. So we have a lot of teens or people in that age range that unfortunately sometimes become homeless, or maybe they have an addiction issue, or maybe they have a victim of domestic violence at home for whatever reason. If they don't have a stable place, they can go into Youth Oasis. They can literally walk in, and Youth Oasis actually provides many, just like Families Helping Families of Greater Baton Rouge, they provide community service programs to create awareness in the community about the services that they provide. You can see their website, youthoasis.org. and the phone number, everything on there. If you need information, if you have or know of someone in that age range who needs assistance, they will help. They oftentimes on their Facebook page, they'll post a need for like clothes or personal items for youth in that age range, just to give them until they can find them, get them back to their permanent home or find them some type of group housing facility. Next slide, please. And for those of you who may live in New Orleans or have friends, family with mental health or addiction issues in New Orleans Children's Hospital, which is located on State Street, Uptown. It's a relatively new. They have a 51-bed behavioral health center, which was desperately needed to serve youth in New Orleans. The Children's Hospital there treats children and adolescents from ages 7 to 17. What's unique about them is they take a multidisciplinary approach, which means that they provide sessions with psychiatrists and therapists. They have recreational time. They do things like art and music therapy programs. They can manage medication. They can do outpatient treatment for individuals in need. They also provide psychiatric consultations and for individuals with autism, medical psychology. They do virtual care, which is the same as what I meant earlier about telehealth. If someone can't make it to the facility, you can get counseling services online. Trauma and grief care, if someone in the younger age group, it loses a loved one, parent or a grandparent or something like that. Sometimes there's PTSD for that, and that young person may need counseling. And then they also will partnership with the City of New Orleans Juvenile Justice Intervention Center. And that kind of ties in with what I was saying earlier about recidivism and keeping people maybe out of prison, again, unless they've done some sort of crime to hurt people. If they were just put in there for a psychiatric issue and don't really need to be incarcerated, New Orleans Children's Hospital will help find care, trauma housing for juveniles so we can prevent having them in jail. So it's an excellent hospital. And if you go to the next slide, I think there's more information. Yeah. So also with the Behavioral Health Center for Children's Hospital, as I mentioned, it's affiliated with the New Orleans Trauma and Grief Center is a separate facility, but they partner together, and they're relatively new, maybe just a few years old, and they partner to assist for mental health issues for children and teens, and they assist patients suffering from trauma as a result of, again, domestic violence, natural disasters, gun violence, family violence, or any kind of negative event or traumatic event. And it's kind of getting a lot of attention nationwide because it can be one facility, even though it's two organizations that are partnering. They have professionals at one facility where people can get multiple treatments for different issues, whether it's mental health or addiction or domestic violence issues. Next slide, please. So also you have, we talked earlier about, aside from the 10 local governing entities around the state, which again are very large facilities that provide services for mental health and addiction, you've got support and advocacy organizations. NAMI, I'm sure many of you are familiar with NAMI. They have chapters all around the state, about 6 different areas. Just recently, there used to be for many years, a NAMI St. Tammany Parish and then a NAMI New Orleans, but they just recently announced a few weeks ago that they're merging into what's called NAMI SELA, which stands for Southeast Louisiana, which is a division of the National Alliance on Mental Illness. So This is a terrific idea because New Orleans and St. Tammany are only 30, 35 minutes apart in terms of just being separated by the lake. And so they decided to merge all their resources to serve a very large population when you combine Orleans Parish and the surrounding towns, as well as St. Tammany Parish, which has cities like Covington, Mandeville. And they're open 8:30 to 4:30, Monday through Friday, main office on Canal Street. And then NAMI also has the national hotline, which is 1-800-273-8255, or you can text NAMI, N-A-M-I, to 741-741. This is serviced by the NAMI national office. There's NAMI chapters all over the country. The national office is based in Washington, D.C., and they provide confidential, free crisis counseling. And even, I know younger people like to text a lot. If they don't feel comfortable calling and getting advice about a crisis they may be going through, they can text to that number and get support. Then there's NAMI, has a chapter, NAMI New Orleans, on the West Bank, which is in Harvey, Louisiana, across the river from downtown New Orleans. And then all the NAMI offices provide training programs that are open to the public. For example, if you have a loved one, a child, a spouse, a partner, or a friend, or anyone suffering from a mental health condition, even if they are getting treatment from a professional psychiatrist or a counselor, these support groups that NAMI provides are very valuable, and they can be for the parent or the family member, and they teach you how to handle or help deal with your child or loved one or partner who may have a mental health condition. So if you think of it like as support groups, for training programs, referral programs, and then NAMI does a lot of outreach. They offer mental health first aid courses, and it's really open to any of them, and anybody who, whether you have a mental illness, but really it's geared for people who have a loved one or friend with a mental illness. And many of these programs are free. Maybe the mental health first aid course may cost a fee, but it's not very much. But if you join a NAMI chapter, I don't think there's a fee to actually join. You can go to these support groups or training programs. Next slide, please. As far as Jefferson Parish Human Services Authority and Metairie, and then the West Bank, here's some of the services they provide. And again, you're talking about a very large parish, probably 700,000-800,000 people that this Human Services Authority serves, and they provide services, pediatrics, integrated primary care, and mental health care. What that means in terms of integrated is, and it's sort of also a new service that here in Louisiana we're opening up more and more of them, where someone can go and get physical mental health, which is primary care, physical medical health, primary care, and mental health care in the same facility. So you don't have to go to multiple places to get a physical checkup and a mental health counselor. They provide services for children, teens, also developmental disability services. They also do telehealth appointments. And they also, just like Capital Area here in Baton Rouge, they provide certain times of the year vaccinations and immunizations. They provide services for medical management of hypertension, obesity, diabetes, women's health programs, smoking cessation treatment. So really a variety of services that are geared towards helping and providing assistance for the whole person, meaning the physical body, the mental health aspect, and maybe addiction if that's necessary. And that's what it means by, in the bold down there, centralized care coordination. And so Jefferson Parish Human Services Authority accepts insured and uninsured people. If you don't have insurance or Medicare or something, and they have sliding fee discounts, scale for payments for any kind of services. So very large, very good facility to treat a number of different conditions. Next slide, please. We mentioned Lake Charles earlier about the Imperial Calcasieu Human Services Authority. You can see the huge RV bus treatment mobile vehicle there. That is for mobile outreach and response unit in the event of a crisis out in the community. Lake Charles obviously it's a decent sized city, but it is in the middle of surrounding parishes that are pretty rural. So that's the purpose of the mobile outreach response unit, and that can serve parishes, Allen Parish, Beauregard, Calcasieu, Cameron, and Jefferson Davis. Next slide, please. Also in terms of private facilities, and what I mean by that is an example is like Beacon Behavioral Health, which has offices in Baton Rouge and New Orleans, and probably some other areas like you see at the bottom, Metairie, Hammond, Bogalusa, Alexandria. Beacon is an excellent company. They're a private company, so they may not take Medicaid, but again, you want to call about that, but definitely would take private insurance. They provide intensive outpatient program and inpatient psychiatric services, and then also have healing and wellness programs. Next slide, please. Also, a lot of us don't really think of this too often, but as a resource to find in specific information or the latest resources or research on mental health and addiction in different areas, a terrific resource is the Louisiana Department of Health. All right, there's a division called the Office of Behavioral Health. The offices are, located in downtown Baton Rouge, but it's a terrific website right there, ldh.la.gov, and it provides an enormous amount of information about mental health services, the latest research on general health care in particular. They were very instrumental in helping to communicate what was going on during COVID, and then the repercussions, mental health, the trauma, all the ripple effects from COVID, which is still going on and will continue to go on for a long time, and then as well as addiction. Other services that you can get information from LDH is services for the aging and adult population, behavioral health for young people, developmental disabilities, assistance questions on Medicaid, Medicare, addictive disorders, and again, disaster, behavioral health response treatment, opioid assistance, suicide prevention services, which you'll be hearing a lot about coming up in September with Suicide Prevention Month. And then if you're a professional in mental health, you can go through LDH to get information on any kind of licensing or certifications that you might need. So, next slide, please. Other bullet points on Louisiana Department of Health, Office of Behavioral Health. They do have a Louisiana Crisis Response System, a mobile crisis response system that's available as an initial intervention for individuals in a self-identified crisis. Teams deploy to where the individual is located in the community. What does that mean? Intervention for individuals in a self-identified crisis. Maybe it's someone who is diagnosed with some type of mental illness or an addiction issue, and they're able to function on their own, self-identify that they're not feeling well, they're having an episode or a crisis, or maybe a friend or family member notices signs of it. You can contact them and they can send a mobile crisis response unit out. As an example, a friend of mine in New Orleans not long ago was having a mental health crisis, and her roommate called 911. They called the police. Okay, that's fine because you want to make sure the person is safe. She was threatening self-harm, But the police also brought a female mental health counselor or social worker along with the police, who were able to significantly help this individual in her having her a crisis and episode. Also, Department of Health provides support with community crisis, face-to-face ongoing crisis intervention response designed to provide stabilization and support in the community after the initial intervention. Behavioral health crisis care, again for younger people, which is a facility-based walk-in center providing short-term behavioral health intervention, and referrals for community-based like volunteer group homes and things like that. And then we've talked about the crisis stabilization a minute ago. And what you have to keep in mind about mental health issues, you will hear professionals speaking over and over about prevention, because mental health, or mental illness, although it's not curable, it is treatable. And people with mental illness conditions can live productive lives. Maybe some people need medications, maybe some don't, some need counseling, some don't, some need a combination. Everyone with a mental health condition or an addiction condition need one thing, and that's a supportive group around them, whether several people, whether it's a parent, spouse, partner, friend, and a support group in the community that they can go to when they feel a crisis coming on. So always remember the Louisiana Department of Health. If you can call them, you can check their website to get information. Next slide, please. This is another great resource, although it's a federal agency. A lot of people don't know about SAMHSA for short. It's the Substance Abuse and Mental Health Agency with the federal government. Their mission is to reduce the impact of substance abuse and mental illness in America's communities. They also have a national suicide prevention hotline, behavioral health treatment services locator, alcohol misuse prevention, research on different issues. They have the phone number there, and it's a terrific website. And they've recently announced funding for opportunities for certified community behavioral health clinics, which includes some of the agencies and clinics I mentioned in this webinar. Recently, $123 million. Now, I can say that as horrible as COVID and the repercussions of COVID were in terms of mental health and trauma and PTSD, a few positives have come out of it, and that is federal agencies like SAMHSA have been putting literally several $billion into mental health and substance abuse, because this country is not only is the suicide rate going up since COVID, but opioid addiction and unfortunately overdoses has dramatically risen over the last 3 or 4 years. And the opioid area, that's not necessarily part of it, could be attributed to COVID, but it's mainly the opioid pills that are laced with fentanyl that are coming in from other places. That's another webinar altogether. But the point is that SAMHSA is putting billions of dollars into treatment centers, and a lot of that money, or a portion of it, is coming into Louisiana and filtering down from Louisiana Department of Health into our communities, small and large nonprofits or clinics or the local governing entities. So the challenge is to, what are these clinics and nonprofits doing with that money? They're creating programs, they're creating awareness, they're creating more treatment centers. So it really is an opportunity to help improve mental health services and addiction services in Louisiana. So next slide, please. Okay, so another a New Orleans-based service, Violink, you might have heard of it. It's a mental health communication service, and what that means is it provides crisis and suicide intervention. If you dial 911, just like you would dial 911 in case of you see a car accident or some kind of emergency like that for the police. You can dial 211. It's definitely in the New Orleans area. I'm not sure if it's available outside of New Orleans, but you can get referrals also for housing, mental health services, food, and again, disaster relief. They provide care coordination, child abuse prevention. They have an opioid texting program and a teen text hotline. It's probably 211, or you can find out just by calling that number, but that's an excellent organization that does a lot of great work. Next slide, please. The National Suicide Prevention Hotline, 1-800-273-TALK or 8255. And then they have the website there, suicidepreventionlifeline.org. That's a 24/7 hotline if you know of someone who is threatening self-harm or has suicidal ideation. Next slide, please. And also, just a couple of years ago, Congress approved funding, and the FCC, Federal Communications Commission, approved the money and the technological support for the 988 Lifeline. This is very, very important. It's a national suicide prevention and mental health lifeline network. You can call, text, or chat 988 to be connected to train counselors 24 hours a day, 7 days a week. And you can do 988lifeline.org for live chat online. They offer counseling, and they will sit on the phone with you as long as you need to talk to someone. And they offer help for any population, LGBTQ, maybe veterans experiencing mental health conditions, loss. If you suicide survivor, if you're a survivor yourself or you lost someone to suicide, that's going to affect you. You can call this number and get some immediate help through the phone. Maternal mental health, and then coping during community unrest. Every community occasionally, unfortunately, has some type of negative event that stresses people out. You always want to remember or punch it into your phone, 988. And then research shows that callers feel less suicidal ideation, they're less depressed, and they feel more hopeful after speaking with a lifeline counselor. And it's a very good resource to have. So you want to keep that in mind, 988. Next slide, please. Also, just some general community resource tips. We mentioned earlier social media. I highly encourage you to follow some of these local governing entities or clinics or facilities that we mentioned on social media. You can sign up for their newsletters, which are very thorough and give details on all kinds of events they're having, which are always free to the public. Participate in support groups. Support groups don't get enough recognition. Most communities have support groups, whether they're run by a governing entity or NAMI or whoever. If you've lost a loved one or lost someone to suicide and you need someone to talk to that understands your story and can relate, you can go to a support group and they're free. You just have to look online to see when they're available. And then you can also volunteer for community outreach events. And if you want to be an advocate for mental health, you can, Louisiana Department of Health has a training program to become a peer support specialist, and that is someone who has lived experience or a mental health diagnosis, but would like to help serve their community by being a peer support specialist. And some of these clinics and organizations will pay a certain amount per hour for a peer support specialist if you're accepted into the program. But these are just different ways you can get involved to volunteer or be an advocate to help fight mental health and addiction issues. Next slide. Again, excuse me, mentioned being a mental health advocate. Part of that is fighting the stigma around mental illness. And that's what all of these organizations do. And when they have community events to create awareness, what they're doing is trying to encourage people that it's okay to talk about a mental health condition, excuse me, or an addiction condition. You can contact your congressman or woman, community leaders about increasing funding and for programs, promote mental health tips and best practices through social media, sharing. If an organization that you follow on social media has a program, you can share it to your group of people that may see it. You can represent legally and otherwise a friend or loved one who suffers from mental illness with doctor visits or treatments, or help them with medications if they're not able to make those decisions for themselves. If you like to write or communicate, you can write a blog that offers solutions, tips, resources for mental health in your community. You could even be a speaker. Libraries are always looking for speakers, schools, to talk about things like suicide prevention or the basics of mental illness. Next slide, please. And so that's a wrap up of this webinar. And here's some phrases that we always use in mental health. It's okay to not be okay. 1 in 4 or 5 people have some type of lived experience with mental health, whether it's anxiety, ADHD, depression. You always want to be here tomorrow, which is the suicide prevention phrase. There's always help and you're not alone. And we want to always be aware that just like not be like in the old days where we're just pushing mental health or addiction issues under the rug. If you yourself or a loved one, family member, friend is experiencing any kind of issue, depression, not feeling like themselves, not going to school, not going to work, generally the saying is that if someone is depressed or not acting their normal self for a 2-week period, then they probably need to see a counselor at any one of these organizations or clinics mentioned in this webinar. So that's it, and I'll turn it over to Keisha to see if there's any questions or comments.
Okay, right now I do not see any questions in my question box. But as before, all attendees do have control of your mic. So if you have any questions, you're able to unmute your mic and ask your question.
Hello, I have a question. I would like to know what resources are available for individuals who may be interested in becoming a peer support specialist, if y'all have any.
Yes, the best way, as I mentioned, is to look at the call or look at the Louisiana Department of Health website. It is a very large website with a lot of, information, but specifically Office of Behavioral Health, or if you just go to ldh.la.gov or just Google Louisiana Department of Health, peer support specialist, it'll take you there, or you can do a search in it. I know they offer it, or they may offer it also through a third party, such as NAMI or another organization, to become a peer support specialist. Now, I know that there is a fee to go through the training. I don't know what it is now exactly, but that would be the best way to find out where there might be trainings in your community, in your area. So you could look at the Louisiana Department of Health website, or you could just simply, are you in Baton Rouge or?
New Orleans.
New Orleans, okay. So they might have even more places that provide trainings. You might want to contact NAMI, or just Google peer support specialist programs, and places will come up. And sometimes the trainings are, they might be a week or 2 weeks long or something like that. And I think the only requirement really is you just have to be diagnosed with any type of lived experience, whether it's anxiety, depression, or something like that, to qualify. And but just Google it and look for the closest program or organization in your community, in your area. And there are a lot of them. They might not offer trainings every week, but it might be intermittently, once a month or every other month or something like that.
Thank you.
Okay. But I encourage you to do it because we always, need more peer support specialists. Someone going through a mental health crisis is much more likely to listen to someone with lived experience and is a peer support specialist than just anyone else.
Okay, do we have another question? Again, all attendees have control of your mic, so the only thing you have to do is unmute and you're able to ask your question. So do we have another question? Okay, Anthony, I think that was the last question. So I want to remind everyone again to please visit our website and our Facebook page to obtain the conference call information and all webinar and in-person training registration links. Also, there's a survey at the end of the webinar. Please take a moment to answer a few questions. We greatly appreciate your feedback. Our short survey takes about a few minutes to fill out. Thank you for attending today's event. It has been an honor to have you present. A certificate of attendance will be granted to all participants. We hope to see you at our next training. Please keep visiting our website, check your emails, our Facebook, Instagram, and X, formerly known as Twitter, pages for upcoming events and their details. Have a great day.
Thank you.